All right. Hello, everyone, and thank you for joining our webinar today. My name is Alejandra Ruales, and I am a Senior Manager at the Financial Health Network. Today, I'm going to share with you the results from an exciting project we developed in collaboration with the National Credit Union Foundation. The project consisted in analyzing transactional KPIs of three credit unions to understand the financial health and business impact of a specific product, service, or campaign that they picked. We are very excited to share some of these findings with you in case that your credit union is looking to evaluate the financial health KPIs of a specific product or service that you currently offer. Next slide, please. For today's agenda, I'm going to kick us off with a quick introduction on the Financial Health Network and the National Credit Union Foundation, followed by an overview of the results from these three selected credit unions. And then we will be hearing from a special guest, Roger Rasman. He's the Vice President of Marketing at Community First Credit Union, who will be sharing some insights in their process to evaluate the impact of their Save My Change program. Then we will finalize with some recommendations and next steps. So to ground our conversation, I'd like to start by defining financial health. At the Financial Health Network, we believe that financial health comes about when your financial systems help you build resilience and pursue opportunities. And I think that this is an important definition to keep in mind as we discuss how the programs that each credit union selected intend to support their members' financial health and continue to support that growth over time. For those of you who don't know us, the Financial Health Network is a trusted resource for business leaders, policymakers, and innovators united in a mission to improve financial health for their customers, employees, and communities. We fulfill this mission to improve financial health for all through our research, consulting, and innovation arms. And to develop this project, we worked in partnership with the National Credit Union Foundation, as I mentioned earlier, and the foundation fully funded the research and case studies that we're going to be talking about today, with the goal to advance credit unions' work to improve financial well-being of of their members and their employees. So with that, let's talk about the project itself a little bit. Next slide, please. The main objectives of this project were to leverage quantitative data to measure components of financial health, and also using those metrics to understand the financial health and business impacts of specific products, services, or campaigns. And to achieve these objectives and to recruit the credit unions that were going to participate, the foundation solicited applications directly from credit unions to be part of the project, ultimately selecting three: Nusenda Credit Union, Community First Credit Union, and Michigan State University Federal Credit Union. But before we go too deep into the project, I'd like to talk a little bit about why it is so important to measure financial health. We really think that these type of projects are important because measuring financial health can help you identify opportunities to better serve members, determine how these products are making a difference in those that you serve. And with this information, you can ultimately either pursue partnerships and or develop strategies to better meet your customer needs. So once you're able to really measure your customers' financial health, you can understand what they need and ultimately develop your own products and solutions with that information in hand. And ultimately, you're able to assess your company's efforts against national, regional, and local benchmarks. And in the case of this project, measuring specific financial health KPIs and business KPIs allowed each credit union to understand if the product or service that they selected was meeting the credit union goals. Just a little bit of an overview and to summarize, we worked with these three credit unions for 6 months, analyzing transactional KPIs to really understand the financial health impact of the products described below. So with Community First Credit Union, I'm not going to go too much into detail because we have Roger that will be telling us later on more about what Save My Change program is. But it is basically a roundup savings tool that it is available to members, where the purchases that they make automatically round up whatever cents are left into a savings account, helping their members save. For the Michigan State University Federal Credit Union, we evaluated the reality fairs, which are a one-day financial education curriculum for high school and college students. And with Nusenda Credit Union, we evaluated their co-op capital, which is a small dollar loan administered by a nonprofit partner. To conduct the evaluations, we followed very similar steps as the ones that are outlined here, and I wanted to show them just because as you start thinking about evaluating the impact of your own product, you could mirror some of the process that we followed. We actually kicked off the process by meeting in person and doing some brainstorming around the potential KPIs that we could track for each project. We actually, at the beginning of each project, ended up coming up with anything between 20 to 30 KPIs. But the final KPIs were selected, and they were way less than 20 to 30. But these were selected because they struck a balance between being available in the existing data systems and being able to show impact. So just to give you a quick example, for the Nusenda project, one of the KPIs that we selected was a change in credit score over that 6-month period. And this is a relevant metric considering that the co-op program is a lending product that is reported on the user's credit score. So by selecting this specific KPI, we were able to track that over the next 6 months, and it was related to the specific impact that that product could have. When possible, we selected a control and treatment group to identify the differences between members that were using the product or service versus those who weren't. Again, as an example, with the MSU FCU project, we compared KPIs between students who participated in the reality fairs versus those who did not participate. In both the control and treatment group, they were credit union members, but some of them were just not a part of these reality fairs. So after selecting these KPIs, after tracking them for 6 months, and constantly having conversations around what could the changes in the KPIs mean, we did a data synthesis, took all these KPIs to understand what they meant in the context of the credit union. And finally, we developed this case study and publication that we will be discussing here in a second. Next slide, please. In terms of the key learnings, and I just wanted to share that I'm going to go into some of the key learnings that we had from each project, not necessarily into the specific findings. Those you can actually find them directly in the foundation's website. I think that it is interesting to talk about the key learnings because if you're trying to evaluate one of your initiatives, then some of these things you could keep in mind as you go through that process. So with the Nusenda project, one of the key learnings was that it is important to check in detail the capabilities of internal data systems before going into an evaluation. Unfortunately, when we started the process, there were some data pooling limitations which caused delays in the project. But once we were able to resolve that, there was no other issues and the project was back on track. Basically, we just wanted to make sure we understood that the data we were pulling from the different systems, from the loan processing systems, from the savings, from different data sources, actually aligned. And once we were able to do that, there was no issue. In the Nusenda project, the results were positive, though small in size. Just to give you an example, we saw that 65% of the co-op borrowers became and remained members once because they wanted to have access to this product. So they see that 65% of these borrowers that came to take on this loan, they wanted to have access to this loan and they were not members before, which indicates that co-op loans or these small dollar type loans could help attract new members to the credit union. Additionally, co-op capital showed that partnering with other nonprofits can be a successful strategy to attract new members to the credit union. So leveraging local partnerships could help in that process as well. With the Save My Change program, again, we'll talk more detail about that one in a little bit here. But one key learning that I want to highlight here is that the Save My Change program was used by members across age groups, indicating that this type of tool can be useful to encourage savings across ages, and that although this project was designed to capture, the project as the larger foundation project was designed to capture transactional KPIs, Community First really benefited from complementing their transactional data and complementing those transactional KPIs that we were looking for with including the FinHealth score, which is a survey that indicates the change in financial health. So this dual data approach helped them to paint a more nuanced picture of their customers when we finalize the tracking process. And some of the key learnings on the MSU Federal Credit Union example is that reality fairs also proved to attract new student members to the credit union after they went through this process. And also we saw some relatively positive trends, some relatively positive KPIs, but additional research is needed to determine the causality between reality fairs and the change in financial health of students, particularly given that this is a one-day financial education course. It was hard to determine if that was really the cause for students to show these positive KPIs or this positive impact. But again, we showed some early positive signs. And in this particular project, we also thought that survey data could have been helpful to assess students' point of view in the effectiveness of the program. And back to the earlier point, considering that it is a one-time intervention, I think students, their perception of the effectiveness of the reality fairs can really provide complementary data for the credit union to understand the relationship between changes of the KPIs and attendance to the reality fair. Ultimately, I think that in these three projects, we were able to see some change. Something that we learned among the process is that really, and I think across the three credit unions, is that 6 months is really probably the minimum amount of time that you want to use to assess a change in financial health. So that's something to keep in mind when you are trying to do these at your own credit union, at your own organization, understanding what the time frame is, and we'll talk more about that later on. Next slide, please. So without further ado, I'd like to introduce you to Roger Rasman. Roger is the VP of Marketing at Community First Credit Union in Jacksonville, Florida. Roger oversees all marketing, website, social media, public relations, market research, community engagement, innovation, and financial wellness activities. So we're very thrilled to have Roger join us today and talk to us a little bit about the process that Community First went through, because we worked very closely together over the course of 6 months, a little bit over 6 months, in evaluating the KPIs for the Save My Change program. So, Roger, I think that you're on now. So, thank you so much. Welcome, and thank you for joining us.
It's a pleasure to be here. It's an honor to talk to you about all the success and all the fun we had with this project.
I love that you're describing it as a fun process, because it was very fun for us to go through it as well. Next slide, please. Uh, I think that it would be a great place to start just by describing or providing some context on Save My Change. So, Roger, why don't you tell us a little bit about what Save My Change is, and when was it implemented? How did Community First decide to implement this type of product?
Well, Save My Change is many companies, both banks and credit unions have Save My Change, where you round up debit card transactions to the nearest dollar, and those pennies go into an account of some sort that accumulates, and eventually it turns into real money. And so, um, we introduced that account in late 2017. And it came from our innovation team as something that they invented in the spirit of solving a problem around saving, that our members really have issues with saving. And the reason we know that is the financial health check survey that we did with the Financial Health Network really showed us one of our big weaknesses within our member base is that very thing, is saving. So when we created this program, it was about that, yes, and it was also about some business things, some business issues around driving interchange income. That's obviously a good thing. At the time, it was about improving liquidity and driving savings balances. For many of us today, that's no longer an issue, but it was then. We also created, at the same time, we created purpose-based savings plans, so a person could direct their Save My Change into a saving for a home or saving for a car type of account, which then gives that person a planning tool of sorts, which is another thing that we really want to encourage our members to do, is do more planning around their finances. So it really was a great tool for us, has been, and this project itself really just helped us kind of take the next step in better understanding the true impact of Save My Change.
That's fantastic. Thank you so much for sharing that, Roger. I really think that what you described, it feels really nicely with the idea of connecting a business strategy to a financial health strategy. So basically, what I have here on screen is that Community First wanted to first understand members' financial health, and you did that through the financial health checkup. And this checkup revealed in some ways that one of the areas where your customers could use a little, or I'm sorry, your members could use a little bit of extra help was through some sort of savings initiative, some sort of a savings product. So basically what Community First is doing is then addressing the financial health challenges identified by this checkup, coming up with a solution such as Save My Change. And what I think is most interesting is that you don't only stop there, but you're also evaluating to see if the solution that you're providing for your members is effective, and deciding to evaluate the impact of the intervention and going through the process of evaluating the financial health KPIs of Save My Change. So I think that you answered this a little bit, Roger, but why do you think it was important for Community First to conduct this type of study?
Well, it's a few different levels, because like we were just saying, it's kind of a path we're on with. We created the financial health benchmarks, and so we want to help people to grow their financial health and their financial health scores overall. We are in the middle of building a financial wellness program. We do have some resources decked against a financial wellness program. We're one of the things I'm looking for is an answer to should we expand that program? Should we be devoting more resources to it? And if so, what are those KPIs, or what are those metrics that will tell us when we should and how much we should be expanding the financial wellness program? So it goes to many ways. It goes to business case and how does it all work? How do the dynamics all fit together, both in terms of member financial health and also in the health, the financial health of our credit union.
Absolutely. And this is where I think that, this type of project, understanding the KPIs and understanding the impact of this particular product is extremely important. And what I love that you're saying, Roger, is that it is part of a broader financial health strategy, right? You're trying to understand, does it make sense to continue expanding and utilizing resources to strengthen this type of, not necessarily this product on itself, but, just continue developing this financial health strategy to holistically, be part of what Community First does. So thank you for sharing that. I love that.
Yeah.
Sorry, anything else to add on that front?
No, I was just going to say it's all about ROI, right? It's an investment, and
Mm-hmm.
what's the return, and how do you manage that? And so, going forward, that's really how we're looking at it.
Yeah, absolutely. And I think this is a really great segue into our next slide, which talks about the process that we went through in evaluating the KPIs, right? So I mentioned earlier, we went through the 6-month process. We had to select a series of KPIs to understand, if they, what was the impact of Save My Change. And what I have here on screen, I'm not going to go into, each specific KPI, but what we want to show here is that every KPI is related to at least a correlation with financial health or a correlation with the credit union business, right? Which is, I think, something that Roger was speaking to a little bit earlier. Does Save My Change generate any change or any increase on financial health, or does it help the business side? So, just to give you an example here, one of the metrics that we selected was individual average monthly savings balances. And, in relation to financial health, higher savings indicate a higher financial health. And this same metric has a positive business impact as higher savings, as a higher savings balance mean higher credit union deposits. Another example on the transactional side is the average monthly count on overdraft fees. This one is directly related to financial health, where if we start seeing lower number of overdraft fees, we can see that has a relationship with higher financial health. So now, and then I guess the other one, and Roger alluded to this earlier, was this idea of measuring the financial health, the FinHealth score. And, again, I think this was something unique to the Community First project, where they decided to include this survey metric to complement the transactional data and, just give you some specific metrics around a SAFE score and a FinHealth score. But, of course, to pull all of these metrics and to incorporate surveys, it was important to have a team that not only was able to pull the data, but also a team that could promote Save My Change. So, Roger, the question that I have for you here is, can you tell us about the team who was involved in evaluating Save My Change, who worked in the project, and why do you think having a cross-departmental project team was important for you guys?
Well, it was very important to have a bunch of good minds on this thing to, because you have a data side to this thing that's really important. Anytime you're talking about research and stats and those types of things, obviously data is a big deal. We have a director of data analytics who was, very critical in this project. We had our financial wellness manager was part of the kind of on the ground part once we got things up and running, but he was also part of the planning for this as well, because he kind of knows what what the members are thinking, what the customers of this so-called are. We had one of our senior marketing specialists on this thing to really kind of do the marketing, and what we created here was a campaign. So this, we have our normal campaign calendars, and what this did was essentially took place instead of a different campaign that we would have done anyway. And so she was instrumental in really getting people, A, signed up for Save My Change, B, getting to take them financial health assessment if that's the case, and then getting them to take the financial health assessment a second time 6 months later to see how their financial wellness or financial health had changed. So, I have a team of 10 people on staff in marketing here at Community First. These three areas, the data analytics team, financial wellness, and just the marketing team, were critical, and you really need all those people to make this work.
Yeah, I think that's absolutely key, because you can, and I think we talked a little bit about this through the project, right? And is the data piece is extremely important. You need to be able to understand what the changes in data are telling you, making sure that you're tracking those data points correctly, that you know how to track them. But also, without participants in the Save My Change program, then you're not able to actually even have metrics to measure. And I think that it was very important to have this blend of teams. Something that I really appreciated about your team, Roger, was it seemed like that there was constant communication between these teams when we were going through the process. Yeah, we had to pull the KPIs on a monthly basis, but I think that there was always an opportunity for your marketing folks and a lot of your team members to chime in and say, hey, what if we I think that at some point we or something that that you guys did was to I think to incentivize the Save My Change participants to take the second survey, the second FinHealth survey, was to enter a drawing to win a cash prize. And I think that's a very clever idea, or like a really good way to get participants to take that second survey, right? I think at intake it's easy to get people to come in, take the survey, and continue moving forward through the process. But I thought that one of those key pieces that you guys did was, just providing that additional incentive at the end. And I think that all reflects that it was just like a good team working together towards a common, a common outcome.
Yeah, and we also set a goal around the number of people that we want enrolled in the program. That was, Deanna really kind of had that one. We targeted no less than 1,500 people that we really wanted, because we knew we wanted to segment this data, and we wanted to segment by age. And we originally were just going to do this for millennials, and then we decided, why not look at everybody? And we can look at millennials alone, but we wanted to then see everybody. So I'm glad we got that. We got 1,600 or so. But yeah, like you said, it's a group of really high quality people that we have here. So
yeah, you're lucky. You have a really, really strong team working on that. And I think that came after a few conversations of, why, just look at millennials. We have a chance to see who else is using these products, who thinks that it is valuable. And again, I just think that came through really great team dynamics. So thank you for sharing that part of the process. Let's move over a little bit to talk about the results, or what did we see as part of the program. So if you can move to the next slide, please. So here, and by the way, I'm just sharing a few of the results that we saw. The full case study is available on the Foundation's website. But although we saw that the transactional KPIs were fairly small, the FinHealth Score survey results showed to be decidedly positive. In terms of savings balances, although there were not significant changes in savings balances themselves, I think that something that is very important to consider here is that the evaluation period was only 6 months, and the amount of savings involved was small, right? We're talking about a round-up savings program. So we really think that it is possible that a larger amount of savings can be observed in a longer period of time. If you think about, buying your coffee and adding 50 cents at a time, that's going to start increasing your savings and adding your savings, but over a course of 6 months, that amount is not going to increase as quickly as maybe some other initiatives. So just to keep that in mind and to keep that in context, I think you shouldn't be discouraged, I guess, for these, for what I label here as no significant changes in savings balances, because the reality here is that we would likely have seen a higher amount if we would have observed this process over a longer period of time. In terms of overdraft frequency, which was one of the other KPIs that we measure, we saw that Save My Change participants went down from an average from 7.3 overdrafts to 2.7 overdrafts on average per month. So this is a significant change that we saw with Save My Change participants, this decline in overdraft frequency. The pattern was not as clear for the non-user group. In terms of number of products held, we didn't really see a significant difference of number of products held by participants versus non-participants. And finally, and I think this was something exciting to see that although the project was focused on transactional metrics, when we looked at changes in FinHealth score, we saw that Save My Change participants saw an average increase of their score of 10 points. When we compared that to non-users over the same period of time, they only increased 3 points. And again, I think something that it is important to provide in terms of context is that, there could be some non-response bias here that could impact these findings. Something else that you may wonder is, or something that you may want to consider is that, the survey takers and the ones who were participating in Save My Change program might have reported better savings outcomes just based on the fact that they joined the program. And I think that's actually good, right? If you decide to make an active choice to participate in Save My Change program and take a proactive step to participate in something that is going to help you increase savings over time, that could start showing a reflection and change on your FinHealth score, because you are taking action. You're now, if you were not saving before, for example, and you're moving to becoming a saver, that's where we could probably see some of these 10-point increase. But yeah, so I think those were the general results. Roger, what do you think surprised you the most about some of the results of the project?
Well, number one for me was a reduction in overdraft. It's a sizable reduction from 7.3 to 2.7. It's not something, to me, it means they're paying more attention to their finances than they once did. It kind of goes back to something you were just saying is I signed up for this, so now, I'm thinking about it. And so that very well could be why it went down so much. That's a healthy thing, I would say. The other thing is, at first blush, you'd say, this is Save My Change, and there's no significant changes in savings balances. And when you really start tearing that apart, it makes perfect sense that, if you do 60 swipes with your debit card and the average is 50 cents you put into savings, so that's $30 a month. Over 6 months, it's an extra $180 in your pocket. It's not a meaningful increase in savings balances. So over time, like you said, it will add up, but over this relatively short period, it just doesn't.
Yeah, and I think that's where when we talk about data, we always have to provide some of those caveats, right? And ideally, and I hope that Community First continues to track some of this behavior, because if you think about, or the number that we all have stuck in our mind sometimes is this $400 savings, right? How many Americans don't have $400 in their savings account? And if you think about it, in 6 months, if we were talking about 180, well, you can start, that starts adding up, and it starts creating a behavior of savings, and start thinking about, as you mentioned with the overdraft frequency, it starts changing, behavior little by little. It might not be significant, if you compare the amount of savings of the rest of the population, and then you compare to the amount of savings of Save My Change. I think that relative to each other, it makes sense that it is smaller, because it's going to take you some time to get there. But at the same time, I like what you're saying, Roger, in terms of, start changing behavior and maybe paying attention to where I spend my money, where my money is located, to maybe avoid those overdrafts. So it might not be just about savings, but also, some other financial health behaviors that this could encourage.
Mm-hmm.
The other thing I wanted to ask you is, we've talked about, how much fun we had about, going about this project. I would like to ask you, what were some of the challenges that the Community First team had conducting the project?
Yeah, the operational side of this thing was pretty straightforward stuff. I mean, it's not anything that we saw many challenges in doing. I think, the biggest challenge, which you kind of alluded to, is the amount of time that we had to see results, to accumulate the sample, to get people to take the survey, those types of things. That's probably the biggest challenge I saw with all of this. Certainly, with a staff that's super busy and fitting it in,
Mm-hmm.
getting their ear. This wasn't exactly something that is a major thing on performance plans here, and so when time gets crunched, they go to the things that are a higher percentage on their performance plan, understandably. And so, that's a bit of a challenge, but I think the group also saw it as like we said, it was kind of a fun project to do and to see the outcome, see what we could learn from it and see how we're helping people, and so that kind of helped to overcome some of these challenges. But there weren't many challenges, to be honest, and it was a fairly easy project to implement. We had great help from Allie and Andrew both, and it really wasn't all that difficult for us.
Yeah, that's great to hear, Roger. And I think, and if we can move to the next slide, that would be great. But something that you mentioned earlier was about, at the end of the day, we're talking about financial health. Financial health is extremely important. Is one of the reasons why many credit unions are doing what they're doing, right? And at the same time, though, you want to make sure that some of the solutions that you're implementing, do have an impact on financial health, and you're not just wasting your time and resources in products that might not have that impact that you want to see. And B, that there's also that ROI aspect of, are the solutions that we're offering also helping us be a better business? And that's that's also a very important thing to consider. And doing this type of projects, doing this type of evaluations allows you to start answering some of those questions, and start at least evaluating and realizing if something is working, if something, maybe you need to complement what you're doing with something else, or you should shift gears. And that's why, again, I talk about measurement a lot, but, measurement is important, and evaluating and refining the current products and services that we offer is equally important. But, with this, again, Roger, thank you so much. I would want to end with two quick questions. The first one is, what are some of the recommendations that you would provide to other credit unions thinking about measuring KPIs, or who want to evaluate a specific initiative that they have, using a project like this as a reference? What would be your recommendation?
Well, my first would be to find a good partner, good research partners, good third parties.
Mm-hmm.
Most cases, for most financial institutions, we just don't have this type of expertise on board on our staffs. And if we do, it certainly isn't at the level that certainly we had for this project. And that's super important. The other advice or recommendation would be, understand that this is a long game.
Mm-hmm.
We started this path. We started here like 2 years ago. Things don't change. This is like, moving a glacier. Things don't change quickly. And, the 6-month time frame, we didn't really look at it as a 6-month time frame. Yes, it was that. for this project, but we continue to work with this. We actually will be just this summer implementing the financial health check as part of the account opening process, as part of the member and account opening process. So we'll be accumulated more and more scores and more ability to help people move their scores up, because they're going to take they're going to take the assessment when they open the account, and then we're going to reach out 6 months to a year later and ask them to take it again. And we're going to accumulate more data. So this, again, it's a long game, but we're playing the long game to try to help people. And that's what this is really all about, is really helping people improve their lives and improving their financial well-being. And it's a very worthwhile thing from my perspective. With the guarded part about ROI, and we need to continue to assess, is it worth it? I believe in my heart it is, but I need numbers to continue to make this work, and I believe it's there.
That's fantastic, Roger, and thank you for sharing that perspective, because I think that you're right. This is a long game. This is not a one-time evaluation, or it could be, but it's just not as effective if you don't continue to evaluate your products. I love hearing a few things. A, that you're going to implement the FinHealth score as part of your onboarding process. That, as you said, gives you a lot of data and gives you benchmarks that you can start measuring yourself against. I love hearing, the long-term game. It's important to keep in mind, because if you stop measuring at the 6 months, then you don't know what's going to happen next year. You don't know what's going to happen with your current participants or with new ones that join the program, if there's an opportunity to iterate this type of program. So I think all of that. And the third one, your mention of a research partner. I think that's also important to have, and be able to have a good research partner that can give you not only insights on the data, but understand what are some of the best ways to structure these type of evaluations to make them effective. So I just wanted to thank you, Roger, for going through this process with us. I do want to thank you too for joining us in this webinar today and sharing your very, very valuable experience with anybody who will be listening to this. Thank you so much for being a partner in financial health, and I hope that we can continue working together in the future.
Yeah, it was absolutely my pleasure, and I'm sure we will be working together in the future.
Yes, I hope so. Thank you so much for sharing your experience. Thank you so much for joining us. All right. So with that, just obviously very excited to be able to have Roger's expertise and then have him directly share with you what it takes. I think that his point of view is extremely important in this piece, just seeing it from the credit union side, and what were the resources used, what were the teams used. And I want to close us off here with a few recommendations in measuring financial health KPIs. We talk a little bit about these throughout the process, but the first one is a strong program evaluation can help credit unions understand limitations, appropriate sizing, and time required to evaluate KPIs. We talked about, how timing felt a little bit short for some of these projects, but again, it still yields important findings. But, having a strong program evaluation is key to get us started, making sure that you have the right KPIs, and understand some of the limitations too, because in some cases, you might be able to track the KPIs, or you might be able to track them, but you're not able to connect them between the different data systems that you have, then that could be a problem. So evaluating that upfront is important. The second one is selecting feasible KPIs that capture impact and are not burdensome to track. Just alluding to what I said before, you could select 30 KPIs, which is what sometimes, we want to do. We want to select everything that we want to measure, but if they're not feasible for your data team to keep constantly track of, it's just going to cause a huge burden on those teams. and with competing priorities that would be hard to accomplish. So just select those those key KPIs that are going to help you evaluate your process, your project. Working with cross-departmental teams in this type of initiatives facilitates execution and member engagement. I think Roger described it very nicely, how the different parts of the teams pulling together to ensure that you're not only getting data insights, but you're able to disseminate some of those findings, that you're able to get some of the customers to participate, that you're able to create, that's important also if you're trying to create a control group, understanding how you can make some differentiation in the wording or differentiation in who's going to participate versus not. That's important, and for that, it is important to have a team that can help you do that, not just your data team. Considering survey data as an additional analysis point can complement findings. We saw these being particularly true, again, in the Save My Change program with Community First. We saw this to be also particularly true with the Michigan State University projects, where those additional survey data points can provide additional insights, as I described earlier. And finally, establishing an appropriate timeline is key to understand the effect of the intervention. Again, each intervention is going to be different, and the type of KPIs that you select are going to show results in a different time frame. If you think about something like a credit score, for example, it's going to take a while for you to see an actual change in credit score. So you might need more than 6 months to see the change. In a project like Save My Change, where the incremental savings are slow, you might want to also have a longer period of time to evaluate savings balances or a similar KPI. So these are general recommendations for you to consider if you're trying to develop a project evaluation on any of the products or services that you have. But again, I'll share in a second here where you can find more information. Next slide, please. So for next steps, the foundation has been incredible working with us and providing resources for credit unions to continue their financial health journeys. So for more information and resources on financial well-being, please visit the foundation's site on screen. It's ncuf.coop/financial-well-being. And the next slide, please. Also, I did want to mention that at the Financial Health Network, we provide consulting support to conduct these type of evaluations. So, Roger talked about the importance of having a good research partner in the process. So I just wanted to point out that if this is something that you're considering, we could be an option to help you continue advancing in your financial health journey process. There are different types of research and consulting services that we offer. So please feel free to reach out if this is something that you're interested in learning more about, or perhaps if you want to consider a different research partner to work with in evaluating KPIs for your organization. Next slide, please. And finally, I just really want to invite you to visit the foundation site to learn all about the results from each of these projects. Again, each of these credit unions worked extremely hard for the past not for the past 6 months. It's been a few months since we finished the actual project, but each of these credit unions work with different teams. We talked about in each of these brief case studies what were the actual results of the product or solution that they selected, but also some of the general findings that I described. So I really want to invite you, if you're considering doing this, to look into these case studies. They provide a really nice breakdown of learnings, findings, which KPIs did we use, why did we decided to reject some of the KPIs at the beginning of the process. So it would be a nice piece for you to read to get additional detail. And with that, I just want to thank you for listening to this webinar. Again, my name is Alejandra Ruales, and I am a senior manager at the Financial Health Network. I am providing my contact information here on screen in case that you want to reach out for any questions about any of the projects that I talked about, or if you have questions about the Financial Health Network or any of the services that we provide. Thank you very much.